Good afternoon, everyone. Today is the 5th, May the 5th, and I'm Alan Harris here at the Seminole County Emergency Operations Center. Had a little bit of technical difficulties there, but looks like everything's working now. So I wanted to give you all an update on what we're doing here in the county related to our response to COVID-19. Um, Before I do that, I wanted to, well, actually, let me go into testing and then I'll go into something else. So, currently testing updates, we have 9,439 tests that have been returned to us here in the county. Want to thank again Advent Health, Allied Health, and True Health. Advent Health had a testing site in Seminole at the Seminole Town Center Mall that was closed on Friday in anticipation of the Seminole Town Center Mall shops opening this yesterday on Monday. Altamont Mall, the shopping center, the shops in the Altamont Mall are currently closed. They'll be opening on the 12th of next week. The testing is still taking place by our friends with Allied Health there at the Altamont Mall. It is in the parking garage on the west side of the parking lot. There are some reservations still available for that testing site. And then True Health. So True Health is also doing some sites, so we'll talk about that. The test results right now that we have received back from those sites is 9,439. Of those, 402 have come back positive, and that is a rate of 4.25%. So that is actually down quite a bit. So about 2 weeks ago, maybe a week and a half ago, we were almost at 10%. So that's the number of people being tested. 10% of those were coming back positive. So of the people that we are testing now, there is a lower percentage. Now we anticipated some of that because we're now testing anyone. So anyone can go get a test. There is no requirement. Prior to that, you had to be sick. So you had to have a fever, you had to have cough, things like that. So we anticipated the percentage to come down, and the percentages continue to come down. Hey Michelle, hey Pam, how are y'all? Hey Mike, appreciate that. The age range of the positive cases now, our lowest age for positive is 6 months. So we just had that in the last year. In the last week, and the highest is 100 years old. So, and we have still 8 COVID-19 related deaths. So no increase in that in Seminole County. So we're really happy that no additional fatalities to report over the last week. We have increased testing. Tomorrow we'll have a test site, pop-up site at Lincoln Heights neighborhood at the Journey Academy. That is off of Airport Boulevard. That has been rescheduled twice, unfortunately, due to rain and thunderstorms. Now, unfortunately, have been watching the news, and it looks like we may get some thunderstorms tomorrow, but it looks like it's going to be afternoon. So after the event. So we are encouraging everyone to please come a little early. If you are going to go to that site, please go a little early because we are expecting thunderstorms later in the afternoon. Allied Health again continues at the Altamont Mall in the parking garage, as I mentioned earlier. You do not have to have signs or symptoms to get tested there. Just know that there are some reservations that are still available for later in the week. This will be the last week for Allied Health at the Altamont Mall. We are looking at another site, hopefully, for them. But right now, this is the last week for them. So if you are interested in getting a test, Saturday will be your last day. Make a reservation at prepareseminole.org, or you can call our Citizens Information Hotline, which is there in the list there, but 407-665-0000, and we will help you with that. We want to thank the American Muslim Clinic and Bueno Pharmacy. They're collectively putting a test together at a number of different sites. I'm going to grab this piece of paper so I do this right. This is targeting the Spanish community, Hispanic and Latin communities. So the sites will be on Saturdays only. They're from 10 a.m. to 2 p.m. These are for symptomatic patients only. So for symptomatic patients only, there's a fine number of nurses and doctors at these facilities. So they would love to expand it, but right now, just because of staffing, they have to limit it to symptomatic patients. On May the 9th, they're going to be at the Iglesia Christian Hispania in Castleberry. On May the 16th, Iglesia Presbyterian in Oviedo. And on May the 23rd, they're going to be at the St. Mary Magdalene Catholic Church in Altamont Springs. All of those sites are up on the website, so you can go to prepareseminole.org and get a list of those sites. Alan asked a question about Allied Health. Allied Health is a free testing option, as well as True Health, and actually the American Muslim group that will be doing the testing on the weekends targeted to the Hispanic and Latin communities. So we are asking, though, that you bring a medical insurance card. So if you can bring a medical insurance card, we would certainly appreciate that, and that will certainly help them to recoup the cost. It also helps us to do more testing. These are nonprofit medical facilities that are doing these. So without that, they can only do a certain number of tests. Now, you do not have a copay, so if you bring your medical insurance card, there's absolutely no copay whatsoever, but they do try to recoup some of the costs so that they can provide more testing to our community, so we ask that you bring your medical insurance card with you. Some people have asked about personal protective equipment for businesses, and where can I get a list, where can I get face coverings, things like that. So the Seminole County Economic Development Department put together a list of potential personal protective equipment distributors, and those businesses are listed on prepareseminole.org, so you can go to our website and get a list of those. And those include businesses throughout Central Florida and Seminole County that are providing that type of service. Today is Giving Tuesday Now. Giving Tuesday Now is a global day of giving and unity for emergency response to the unprecedented need here that was presented, of course, through COVID-19. In Seminole County, several organizations have truly stepped up and helped our community, so I want to thank those right now, and I have mentioned a couple of them, so let me just go through it again. True Health. True Health is a great partner for the pop-up test sites. Allied Health. They're the ones that did the drive-up test site in Altamont Springs and are continuing that, of course, through Saturday. Harvest Time International and the Sharing Center. Harvest Time International and the Sharing Center has provided food, other types of materials to individuals that are isolated and quarantined in their home. And they are just wonderful people over there. Consider them. Meals on Wheels. Meals on Wheels has provided meals to individuals that are isolated and quarantined, as well as seniors in need during this very difficult time. They've enhanced their food delivery services for people in need, so we really want to thank Meals on Wheels. Also want to thank the Foundation for Seminole County Public Schools. During this isolation and quarantine period, there have been quite a few school-age children that were also isolated and quarantined due to COVID-19, and this foundation provided school supplies for the children that were there. So we received the materials from the foundation, and then those were delivered to the families, so they didn't have to leave the house. They were able to stay inside the house, isolated and quarantined. On our website, prepareseminole.org, it has a list of all those nonprofit organizations, so certainly want to thank them again for their service, and they've been just wonderful partners throughout this event. And I got to tell you, they've also been wonderful partners for every other event. Hurricanes, floods, all of these events, these organizations have stepped up time and time and again. Most of y'all know that I've been around here since 1999 and in emergency management since August the 13th. That was my first day, 2004, when Hurricane Charlie hit. And Harvest Time International and the Sharing Center were still our partners back then in 2004. They were our partners for Charlie, Francis, and Jean. They were partners for Tropical Storm Faye, which was the worst flood event that we had here in the Central Florida and Seminole County area. And they were, of course, here for Irma and Michael. So they've been with us. They've been supportive of us. And I forgot, Operation Haiti Relief, when over 10,000 people were evacuated from the country of Haiti, and they flew in here to the Orlando Sanford International Airport. Those organizations provided food, clothing, things like that. So we just really want to thank those specifically those two, but also our health partners. Our health partners, True Health, and Allied, and those. Now, Allied is brand new with us, but True Health has been around for a while, and they've really helped us see us through some very interesting events, being Zika, the planning for Ebola, H1N1, swine flu, things like that we have experienced here in the county. Let me get to some testing, or some questions. I just saw testing. Jenny, hey Jenny, how are you? Jenny asked about antibody testing, current places in Seminole County for antibody testing. So let me go through the list real quick. And just so y'all know, we are working, I can't reveal it yet because we still haven't worked out all the details, but we are trying to get some antibody testing in a drive-through type of experience. So we are working on that. We're hoping to get that done. We have a nonprofit organization, actually one that I mentioned, that we're working with, and hopefully they will get everything all set, getting all the tests and all that in the labs already. And if that's the case, we could potentially open something, hopefully as early as maybe next week. But we're just hoping that all works out. But for today, if you want to go get antibody testing, here are the locations that you can do it. You can go to the urgent care of Longwood. You can go to the First Choice Urgent Care of Oviedo. You can go to Stages of Life Institute, that is in Longwood. You can go to Sacowi, SACOWI Medical Clinic in Longwood. Or you can go to your primary physician and get a prescription to go to Quest or LabCorp. And let me make sure here. I just want to make sure that I say yes. So LabCorp also has the telemedicine. So if you don't have a primary physician or someone that you go to regularly, you can go to the LabCorp physician. So that would be telemedicine. So you would make the reservation through the telephone, and you would see the doctor, explain to them that you want the antibody testing. They would get you a prescription, then you would go over to the facility, a LabCorp, and get the test done. The Quest is also offering the same type of thing. Tara asks, when will the DMV offer road tests? So if you go to Seminole County Tax Collector, they are opening some of their test sites, soft opening this week. I know that they are planning on opening more next week. So hopefully by maybe the end of next week, they may be open for that type of activity. But if you go to Seminole County Tax Collector, Joel Greenberg's website, he should have updated information. He does have updated information of those. So Pam asked, is there a percentage of false results in testing? I would say, Pam, of the term they use is not false. The term they use is inconclusive. So we do get some test results back that populate into our system that say inconclusive, and what that means is that the test kit would be inconclusive, and in that case they would ask the individual to take an additional test. So it would be up to the primary physician, or it'd be, if you went through one of our drive-through sites, you would receive a phone call and say the test that you took was inconclusive. Did you want to take an additional test? And in that case, we would offer the individual an additional test to try to get a conclusive test results. That happens sometimes. It doesn't happen a lot, but it does happen sometimes. And in those cases, we would love for the person to come back and get a test to fix that out. Will the county track results of the antibody test? Good question, Mike. Right now, the state is not tracking that. So all these lab results go into a system called Merlin, and that system is managed by the Florida Department of Health, and they give access to the county for certain types of data. Right now, we don't have information for the antibody testing data. But if they do, please know that we'll pass that on to you. But right now, we're not getting that data. It of course goes directly to the patient, but we're not receiving data on how many people have had antibody testing, how many have come back positive, how many come back negative. Definitely would be an interesting statistic. It's something I promise to you that I will ask. In fact, just make a note of it in just a minute. But I will ask the state tomorrow during our state conference call. We have one every day, right before this actually. And I will ask them if they are going to start to include that, and I will encourage them to add that to the reporting that they give to us here in the county, so we can provide that information to you. Pippi asked, cost for antibody testing or COVID testing. Sorry about that, guys. Meant to turn that off. Oh, and it's Tallahassee, so it's probably, I'll call them right after. Is there a cost for antibody testing or COVID testing for the uninsured? So for the COVID testing, no, Pippi, you can go and get a test right now at Allied, or you can go up to Harvest Time International. I hear both actually are doing pretty well. If you go up to Harvest Time, there's not much of a wait at all. That's up there on just north of 46, so you can go there and get a COVID test. There's no copay for that, so if you are uninsured, you can absolutely go there, get a test, and there's no copay whatsoever for that. For the antibody testing, we're still working on that, so we're still trying to figure out what that would be. I know for a couple of the clinics, they are not doing the copay, so contact Sequoia Medical Facility, Medical Clinic, and Stages of Life Institute. Those I both mentioned earlier. They're on our website, prepareseminole.org. Next week, if we do open up the drive-through site, and again, we're really certainly trying to do that, but if we can do that, we certainly want to do that for you. And with that, hopefully there will be no copay, but Tallahassee is calling me on every single one of my phones, so it should be interesting to hear what they have to say. But sorry about that, guys. But guys and gals. But that's so we're trying to get it where it's no copay, but just don't know that yet. Let's see. Theo asked, when can nail salons open? We in the county. So I'm glad you asked that. So let me talk to you a little bit. There has been some misinformation, actual information that's being passed around the internet through social media. So let me tell you how this all works. There are a couple people out there that clearly don't like me, and it's okay. They've taken it to personal attacks at me, and I try to do that. I'm a public servant here, and I try to serve Seminole County to the best of my ability. I have since 1999. I do not sit on a throne during a disaster. I do not sit in an office somewhere and think up ways to write executive orders, as some people may say. There is an executive policy group. It's written in our comprehensive emergency management plan, which is adopted by the Board of County Commissioners. The executive policy group is made up of the sheriff of the county, the county manager, the county senior legal, which is the county attorney, a medical doctor, the medical director for Seminole County, which is Dr. Todd Hussey, the health officer for the Florida Department of Health, which is Donna Walsh, the fire chief, which is Otto Droz, and deputy county manager for economic development, Tricia Setzer, and the deputy county manager for operations, which is my boss, Joel Abel. And we all sit together and discuss what is going on in the community. And we look at medical data presented by the medical doctor, Dr. Husty, the epidemiology, which is presented by Donna Walsh, which is a senior epidemiologist. And together, collectively, we come up with what the strategy should be for whatever needs to happen in the county to make the public safe and our community keep them healthy, keep them safe from whatever the event is. So whether it's a hurricane or tornado, whether it's a flood, we all for all of those things. We've met again the Hurricane Irma, Hurricane Dorian. We were all meeting together. So and of course this event is no different. We all met together, and I am so. What do I see in this group? And I have the privilege, I guess, of signing the document, or maybe not a privilege. Maybe it's a I would actually not call it a privilege. I would call it it's just part of my job. That is what I do. So we all sit together and we discuss these types of things, and we come up with a concept. And then that concept is written into some type of executive order. And we certainly look at businesses and things like that. So early on, there were two counties, Orange County and Osceola County, that issued executive orders, talked about essential and non-essential businesses. And they said, we did get some phone calls from them, hey, Seminole County, you can come on board. Our executive policy group met and they said, no, that's not the way we want to go. The CDC is suggesting social distancing. I think that's the best measure. So that was, and I say we, the group, decided that was the best way that we wanted to move forward. So in Seminole County, we issued an executive order requiring social distancing. So what does that mean? That meant things, tape on the floor and things like that. Making sure that people tried to stay 6 feet apart. Queue lines were appropriately marked at stores and things like that. So that's what the executive policy group did. And it doesn't stop there. So the executive policy group, once they have made their determination, we need to make sure, as the executive policy group, that all 7 cities understand this and that they're okay with it. So all the city managers also get together and the mayors, and we discuss what was proposed, see if they have any changes, adjustments, things that they are concerned about. Should we modify it in any way? So for each order, we probably have, and this last one that we did, we had about eight virtual meetings in total, 4 for the executive policy group and 4 for the city managers and the county staff, so county leadership. So the information that was out there that I sit in some tower and is absolutely completely untrue. It's just it's not nice, but whatever. I don't see it because I just don't follow that, but I have been told it, so I just want you all to know that that's the way these groups, this executive policy group, comes together, and this is how executive orders are made. So, Theo, to your question, I know it was a long answer. When can nail salons open? We're fine. Seminole County wants you to open as soon as possible. Unfortunately, it's not up to us. It's the state executive order right now that's preventing it, not Seminole County's order. Seminole County, in fact, when we got together as an executive policy group, we actually even brought up specifically nail salons, hair salons, tattoo artists, massage therapists. How can these people open if we had an order on the books that says they have to keep 6 feet apart? Well, the answer was pretty clear. Dr. Hussey said, well, why don't we just allow masks? And that would allow them to do that. And we looked to Donna from the EPI side. Yes, that's exactly what now the Surgeon General is suggesting. That is now what is part of the CDC advice. So let's do that. So we modified the executive order specific to allow those types of facilities to open up as soon as possible, as soon as the governor opens up. So Theo, if it was up to me and if it was up to Seminole County, the way everything is written, you could open today. Unfortunately, the state's executive order does not say that, but I can tell you, the governor is working on it. He's already had a roundtable. He just had one, Saturday in Winter Garden. So hopefully they are moving in that direction. Jenny asks, any place offering unemployment applications? We still have the printed applications, right? Mm-hmm. Yeah, we still have the printed applications. And I know the website's getting much, much better, but we have printed applications at community services as well as all city halls. So those are available. So if you are having a problem still with the website, you can do that. But I've heard the website is much better. I know they were having a problem a couple days ago, but they seem to have gotten that fixed. I would suggest that. I also have heard, so half of my household income is gone because of a furlough. So we had to get up in the middle of the night, about 2 in the morning, and log in, and didn't have any problem filing for unemployment. So it's kind of a pain in the butt to wake up in the middle of the night to do that. but that was something that we did. So just that may be a suggestion of things to do. So let's see, anything else here? Oh, talk about. Let me. Well, we're almost. Actually, we are at the time. Sorry. So it is 12:26. I went one minute over. Everyone, I want to thank you all so much for being on today. So I went a little bit into the executive order, but I thought it was very important because there's just a whole bunch of, there's a little bit of misinformation out there. So, and certainly some personal attacks. But, I'm trying to be a good public servant. I have since 1999, and I will continue to do that to serve a community I love here in Seminole County. And I want to thank y'all so much for allowing me to be a public servant here in the county, and helping, trying to protect our community from all hazards. We are preparing for the hurricane season. We have not lost sight of that. It's going to be a different type of response than ever before. Sheltering that does not look like it used to, but we are working on that. Special needs clients, if you're listening, we have you definitely in our minds, because I know that used to be a very communal type of sheltering. So we're looking at how we can separate people and make you more full. So we have you in mind, and we are working on that. Even while working on COVID-19, we are working on other hazards in our community. Y'all have a great week. We'll see you on Friday. Flip over to Seminole County Public Schools. They're about to go on Facebook Live. Walt Griffin, great people over there, are going to provide some great information. So I'll tune in to them. Y'all have a wonderful week. Thanks. Bye.